area, please, as they're doing the cleanup and the mural painting. And they might, come off on the outside lane maybe. So just be safe. It's 8:43 in the KUAM News Zoom room now. We have Speaker Therese Terlahi, Senator Tello Taitigui, Senator Joanne Brown. We're talking Bill 112 as the three big sponsors here on the show this morning. There was an informational hearing. It was a couple days ago. Speaker, if we could just kind of clarify, because I might have even been one of the people who was confused about the schedule of hearings and which ones are the ones where the public can come and show up and give testimony. So the one a couple days ago, that was more of like was it kind of like a counterpoint between the two attorneys?
Yes, it's an informational briefing. So we wanted to, first of all, introduce the bill, make sure that the facts are out there, and then welcome testimony from anyone on July 7 and July 12. We found in the last years that when we had these hearings, there were lots of people who came to testify, and so they could go all night long, and we have a limit of how long we can go in the evenings, but doctors have always requested that these hearings be held in the evenings. So we're trying to accommodate all of this. So we've spread them out, and we're, so from 5 to 8:30, hopefully, and we will have to have more if we're not able to hear everyone who has come to testify. But that's what we're trying to do, is get everybody signed up right now who's calling our office or emailing interested in testifying. So July 7 and July 12, 5 p.m.
And this will be at the Guam Congress Hall?
They'll be in person and virtual. There are some people who have requested to testify virtually, so we are going to accommodate that as well.
Via Zoom?
Yes,
okay.
Via Zoom.
Are you anticipating a similar turnout, compared to your hearing you had on the American Rescue Plan for that resolution? Because it was a pretty cool turnout, as you had a lot of people zooming in.
Yeah, I'm not sure. I can't predict those things. If I'm basing it on the last hearings that we had in regards to medical malpractice, there were a lot of people who came to testify. So, and if we are basing it on the response by the doctors and the letters that I'm receiving, if they actually come to testify, there will be a lot of people. So right, I look forward to that. Yeah, I'm really looking forward to, and I appreciate, there are some doctors who have sent me letters with very excellent suggestions as to how to improve this bill. And I intend to incorporate those suggestions as much as I can, as long as they're not going to, in turn, create this huge additional burden on taxpayers. Okay, so I think we have to balance that out. And some of the suggestions, that's all they ask, is that we're going to put this burden back onto the taxpayer. So I don't think that that's right. And I don't think we should, cut off any ability of claimants that are rightfully entitled to something. So what we really want to do is, that's why we went through 3 hearings. It was the only proposal on the table at the end of last year. It's the only proposal that's been on the table, this year. And we've tried so hard to come to a compromise of interests. We have plaintiffs who are clearly, these are people harmed by negligence. Not just people who didn't like the outcome of their cases, but people who are harmed by negligence are clearly, and the legislature has been put on notice that they are clearly being prohibited from pursuing justice. And I think that's a huge burden on us senators. It's clear before us. There is no disputing that. And I want to very much commend my colleagues who have been courageous enough to put their names on this bill, knowing full well, based on the last hearings, that this was going to be controversial, that we are not going to make everybody happy, and that but that we have a huge injustice to solve, and that we are going to do our best to do that. So I've had some very courageous colleagues, and I want to thank them. There are two of them are here with me today. There are others. There were 12 who signed on to this bill. And so, of course, the withdrawal by the vice speaker minutes before the last hearing, she called me up and told me she's going to withdraw. And I asked her to please hold on until the public hearings were over so that we can hear everything. And, obviously that's not what happened, but regardless, I just think the public should know senators are under huge pressure by the medical community to, dump this bill and move on and ignore the injustice that sits there, pointed out to us by a district court judge and the people themselves who were harmed. And, I wouldn't be surprised if everybody on Guam knows somebody who is just not, who's not one of those that just didn't like, their treatment or something like that, but who were actually harmed by wrong treatment contrary to what they even, agreed to, or treatment that was, as has been found, very below the standard of care. That's what we're talking about. And so we went to great pains in this bill to make sure that we do not touch the standard of care. The doctors were so adamant, that they are practicing what they can on Guam under the conditions that are available to them. And I absolutely appreciate that. And so that's why in this bill, we kept the standard of care exactly the same, meaning if they're practicing standard of care today, that should be that is still acceptable standard of care tomorrow, exact same. And so, there's been a lot of, I think, threats that this bill does something to change, how people practice medicine or what's the appropriate medicine to practice. And this bill doesn't do that. And there's something else that may be doing that for them, but it's not this bill. This bill says exact same standard of care. And so I understand that not only senators are under a lot of pressure under this bill, but that letters are being sent to patients, and they are under huge threat of discontinuation of service. And, I can't even put into words my response to that. I find it quite unconscionable, honestly, but, these are clinics, they're going to do what they think they need to do for their bottom line. But I just think for the people of Guam, I'm not going to abandon them. It's clear they cannot seek justice. And it's clear that we are trying to accommodate doctors, make them have special protections that no one else in the community is afforded. No one else. Do you have to go through a special screening panel in order to get to court? Anyone else who injures you, you get to go straight to court. And you're going to pay $300 filing fee. But if you get injured in a medical malpractice below the standard of care, you have to pay $10,000 filing fee. You have to pay $450 an hour for a 3-person arbitration panel. And the courts have found this to be unfair. It's so unfair that they are considering, bypassing the law themselves. So I just think while we are on notice as senators that this law has huge failings, it's not doing what it intended to do 30 years ago. It has become the injustice that it, tried to fix 30 years ago. We need to tweak it, and I think we can. So we've allowed arbitration under this law. Doctors who really want to go to arbitration is available to them under this new law, under this new bill, this bill. Arbitration's available to them, and it can be cheaper arbitration. It doesn't have to be the most expensive arbitration available to us today. It can be cheaper, it can be affordable for patients. And if they cannot agree on arbitration, then we've suggested that a magistrate judge, somebody who's appointed by the Supreme Court justice, confirmed after a public hearing and confirmed by the Guam legislature, that person will hear from medical experts, hear from the patients, and make a determination whether this deserves to go forward, whether this is a negligent claim or a frivolous claim, and make a determine whether the patient should be entitled to some type of justice.
All right, we'll go on with Senator Joanne Brown. Speaker had referenced Vice Speaker's very public and well orchestrated withdrawal of her sponsorship of this bill. I mean, you could tell this was something that they had worked on and maybe put out minutes before the hearing for the most impact, right? But why haven't we seen anything from the opposition to 112 that specifically cites which measure in the bill is going to harm the medical community. And also, I did want to, I guess we'll just start there. Do you guys know, like, what their specific concern is with Bill 112? Senator, tell us, Senator Joanne.
Yeah, well, I think there were three issues. And first, I'd like to thank you, Chris, for this opportunity and everyone listening to the link today. First, I think there was, the ones that I received were three points. Frivolous lawsuits, cost of health medical malpractice insurance, and specialists. So far, those were the complaints that these doctors were talking about, these three areas. And it's obvious the frivolous lawsuits, like in 23, I think it's 23 districts, Madam Speaker, if I'm not mistaken, doesn't even have a screening panel or any opportunity to weed through frivolous lawsuits. Right. We incorporated this ability to go through the magistrate judge to do just that, to weed out the frivolous lawsuits, to have it confidential. Everything is confidential. That's what's currently now in this law. There's no confidentiality in place. This bill 112 allows that confidentiality and to go through the process to determine whether this is frivolous or not. So that has been addressed. As far as cost of medical malpractice insurance, they have it on Guam. But unfortunately, I would say, and there's really no true numbers, but I would estimate that only 30% of the doctors on island have medical malpractice insurance. And there's nothing in this legislation at all requiring that doctors have medical malpractice insurance. Some states do, like Florida. Florida has a law that you must have medical malpractice insurance. And if you don't, you have to post it in your clinic and you have to prove to the insurance commissioner that you have enough money in the event to, if you had a lawsuit against you, that you would be able to pay out that claim. It's kind of a bonding. The second one is specialists. They talk about, oh, we're not going to be able to bring specialists to Guam. Well, we haven't been able to bring specialists to Guam for decades, even with the current law in place. But what we have been doing is bringing specialists to Guam on a rotating basis that come to Guam maybe twice a year and stay for about a month. But since COVID, it has taught us the utilization of telemedicine has really been an asset to our medical community, to our public health community. It was when I was talking to Lillian Posadas, talking about if a child came into Guam Memorial Hospital who is a diabetic, and there is no specialist for a pediatrics diabetes specialist here on Guam. But what they do is they stabilize the child, which is considered the standard of care, in which they do. And then they make a phone call to someone who is a specialist in the States or other areas surrounding Guam that they can get a hold of to talk about what they need to do, because there is nothing on Guam here. This bill would not stop the specialists from coming here, because one, these specialists that come here from other states or territories already have medical malpractice insurance. The majority of them do. When I talked to a nurse who's been on Guam for about 4 years, and you know, Chris, there is politics with these physicians and the doctors area, and you mentioned that, how politics was really prominent during COVID. Yeah. And doctors are afraid to come forward and support this. There are doctors out there that believe there should be a balance, that they realize that this is a bit unconstitutional, especially for indigent people, you know, and so they're afraid to come forward. But specialists that come to Guam cannot afford to stay on Guam because we don't have the population to support that individual. Yeah. So, you know, it's showing the ugly with these doctors coming out and saying that we're going to leave Guam, we're not going to get specialists. I mean, you asked about the complaints. These are some of the complaints. But if you remember and recall, when GMRC, the intention to build a new hospital on Guam, remember that? And all the doctors on Guam were upset and on arms about, this new GMRC hospital coming and taking all their patients. And they were screaming about that. In the medical, someone told me that as far as government politics, is nothing compared to the medical politics. And it's scary. It's scary because people who want to come forward and talk about what was wrong to them are too afraid because they still need medical care. And I don't blame them because that's happening to me right now. So, I don't, I just feel bad that, people are so afraid and to come forward because in fear of their child or themselves can't be seen by a doctor because a doctor will threaten. What these doctors are doing is causing mass panic in the community.
Yeah, and Senator Tello, it's kind of turning into a game of chicken. And let's go over to Senator Joanne Brown now. Senator, yeah, so kind of what I was wondering, and maybe get your comment on this, is as it stands today, nothing with arbitration or medical malpractice has changed. So why do you think it is that we're getting this avalanche of letters from, God, pretty much every single doctor on Guam or clinic or organization saying that not only do they oppose the bill, but that, Senator Tello's right, patients are getting letters saying that, hey, we're not going to be able to see you anymore because of this Bill 112. So kind of what do you make of the doctors coming out and I'm not going to use the word threatening, but just saying that, hey, because of this bill that hasn't even, just been introduced, it hasn't been debated or passed, we're not going to be able to do all these things. Sorry, but we can give you a referral. Because that's a pretty strong flex.
You're right. It's a very, very strong flex, and it's really, really unfortunate that this is happening, Chris, because the intention behind this bill was never to go after our good doctors in our community. These are our healers in our community, and we've seen certainly over the past year during this pandemic how critical our doctors and nurses and those in the medical profession are to the service of our people. And we know we have a lot of good doctors out there, a lot of good people in the medical profession that help our community every single day. And this is not the intent of this bill. The intent, as the speaker mentioned, as Senator Tello had mentioned, is to address any actions that are negligent. It's a doctor that has been negligent, that has not provided the standard of care in our community. Where someone is harmed and not having any recourse to be able to address that process. Imagine if you're victimized by this process or a family member or a child of yours. And then to begin with, most people don't even have this kind of money, in their back pocket to even go through this arbitration process and even going through court. We know that is not a cheap process. Even if you and I had a minor disagreement about an issue and we ended up in front of a judge, the amount of thousands and thousands of dollars, Chris, that would just cost us because we didn't have an agreement on something that we were challenging each other on. It's a very expensive process. Justice is not a cheap process. We'd like to think ideally it is, but it isn't. And most people, they get by, maybe they have a few extra dollars here or there, but not everybody's walking around with that kind of money to address this. And it's a negligent action that we're concerned with and ensuring that, our people do get that standard of care. And that's what we are recognizing, understanding that there are limitations with that, but that's not what this bill is about. I am one of those patients. I won't say the clinic, but the clinic I've been going to for now 33 years. I go to the post office the other day and I'm thinking, oh, is this a reminder for another, appointment, or is it a bill? Is it a bill that I have to pay? Only to find out it's a letter from the clinic informing me that because of this bill, there are services they may not be able to provide. Like you're just saying, this bill was just introduced. We haven't even gone through the debate process. We haven't even completed or started formal public hearings on this process to get the input of both the medical community and, of course, our members of our community, our people having the opportunity to come forth and testify. as I mentioned the other day during the informational briefing, we need to look for a balance in this issue because there has to be a balance. These are concerns that are being addressed by our people. We're legislators, we're not doctors, but we're legislators representing the interests and concerns of our community. And we're here to listen to that. We're listening to hear what our people are concerned about as well as the medical community. But the way this process has been moving forward and the way that they have come out so loud in a very negative way, I mean, all the way to the point of trying to use the patients in the process of this agenda without trying to look at how can we work. Because I assume our whole objective is to ensure that we have quality care in our island, in our community. I'm sure our medical professionals recognize that probably even more than we as patients coming in who need their guidance, who needs their professional expertise to help us through this process. So it is concerning that is the message that's being put out there, and it's being put out there in mass. I mean, when you're notifying your patients, and I've never gotten anything like that in 33 years as a patient. If we have to worry as a community that, oh my gosh, we're not going to get services provided to us because we're speaking out or because we're legislators. And Senator Tello, I really feel for her. I mean, it's really unfortunate that because we are in the position that we are to represent the interests of our community, we end up getting targeted with fear that we're not probably going to get the medical care we need. And she certainly has openly discussed that. And I appreciate the fact that she is, because it's not easy for a lot of people to talk about their health issues and circumstances and what they're going through. And then to be told, by the way, we're not going to be providing you services and you've got X amount of days to, get another referral. I mean, that's not right. That's not the right message that should be sent out to our people. And it further, creates that impression of negativity towards the medical profession, because that is what's coming out. We're not really talking about what the real issues are. We're not trying to set a situation up where people are just going to start suing doctors left, right, up and down, and everywhere you turn around. I think that's why we want to ensure that we don't have frivolous lawsuits out there, because they're a waste of time and resource. But if there's a legitimate case out there that someone feels, there's been negligence in their treatment or the treatment of a loved one of theirs, and they want to seek justice, there needs to be a means and a vehicle to do that. And I think that's the discussion we should be having. And how do we do it in a way that allows that process to facilitate if it's a legitimate claim? Because I'm sure there are good doctors out there that don't want to see others in the medical profession. And certainly I'm sure it's a very small percentage, but if that small percentage affects you or your loved one, of course, that's something you're going to be very, very concerned about. But I'm sure that the medical profession also wants to ensure that their fellow professionals are providing the standard of care that we would expect of them, probably even more so because they're more knowledgeable about these issues than certainly the rest of us are in the community. And so I'm open to our further discussion. I certainly look forward to the public hearings. I look forward to hearing all sides of the issue. And I'm hopeful that instead of the threats, these direct threats that have been put out by members in mass by the medical community, that they're looking at how can we address a process that can also provide them and address the concerns that they have, which I'm sure they feel are very legitimate concerns. And also, ultimately what our focus of all of us as legislators and medical professionals in this community is wanting to ensure the health and well-being of our people. That's really the bottom line of what it is that we're concerned about in this whole process.
Let's go back here. So, Speaker Terlai, did you get a letter from your clinic? Sorry, I don't know if it's HIPAA. You don't have to answer.
Not specifically. I'm not with SDA, so I didn't receive that as a patient of SDA, and I haven't received a letter like Senator Tello has specifically to me in regards to my own case. However, I have been called by even the director of GMH saying that doctors are refusing care today of patients at GMH because of the bill that we introduced that's not passed into law, as Senator Brown pointed out, and that doctors are refusing. And then, of course, I've been told by clinics, I've talked to many doctors, and they're telling me, yeah, but they threatened this in the last 3 hearings that we had. They threatened to leave Guam. If you remember this, there were several extremes. Some that came to the table, I believe, in very good faith and said, we know that there is a disparity in justice that has to be taken care of. And we are willing to work to do that. And then there were some that came in and said, you tweak this law in any way and we're leaving Guam. And so, you know, I have to take care of the injustice. And in the same time, I am trying to take care of the medical community and afford them this special privilege that is not afforded in 23 states, first of all, and to continue to allow them what seems to be their preference is arbitration. This bill continues to allow arbitration. And to put in something for those who cannot afford it in any way, to get rid of this disparity between rich and poor. And that's really the bottom line here. Rich patients can afford to seek justice if they were harmed by negligence. Poor patients are not. And I just cannot imagine that our community is going to continue to live like that. As Senator Brown said, going to trial for harm is already cost prohibitive. It's already hard to find lawyers who will even take those types of cases. I mean, very hard. And to you know, hire the expert witnesses and go to a trial is already cost prohibitive. But our law it's been pointed out so clearly to us, requires you on top of that to go through a mandatory arbitration panel that is extremely cost prohibitive on top of that. And so all we're trying to do is change those options and make arbitration subject to agreement as it is in every other case. Every other case that's not medical goes through arbitration by agreement of the parties, right? They're entitled to this. And that allows parties to come up with a process that they can afford or that they agree to, you know, mortgage their house in order to afford. Don't forget, we're talking about people who've already suffered the harm. People who've probably already been through medical processes that have drained their bank accounts. People who already were living, you know, below the poverty level. And we've seen the statistics on Guam that it looks like a huge amount of our population are in this category. But unfortunately, this arbitration law that we have in place doesn't just affect indigents, it affects even middle working class people who are not going to be able to put down this $10,000 off the top to pursue arbitration and then pursue the expensive court case after that. So that's it, you know? And so I feel like if they're practicing standard of care, we are going to protect that. We are allowing the exact same standard of care. If they want arbitration, we are allowing that. They can go arbitration. And if they cannot agree, we are allowing those people who cannot afford arbitration a process to go take this before a magistrate judge, some type of screening, together with expert medical witnesses and as many medical witnesses as you want to bring in to decide, you know. And this is an extra process that we are mandating still. We're still mandating in this law, this bill rather, a huge other extra process that is not afforded to doctors in 23 states. So, you know, we're very much trying to make it what we can.
If I may add, you know,
fair.
if I may add something that not only it's $10,000 just on the filing fee, but you're looking at $450 an hour for these individuals, these arbitrators. So you're looking at a cost really through this mandatory arbitration costing upwards to $40,000 to $50,000. Yes. That's how much it costs. Not just the that's just the $10,000 is just the filing fee. Yeah. But after it's done, and you have to remember, this arbitration will take almost 2 years to probably finalize when you go through this arbitration. And then by time at the end, if you're not satisfied with the outcome of the arbitration, you have the ability to go through trial de novo, and that is start all over again. Well, that start all over again is going to cost you, again, you know, tens of thousands of dollars to go through that process as well. You know, there's also an opportunity to go in this legislation, not only arbitration, you still have that prerogative to go through arbitration if both agree, but you also have mediation. We've incorporated mediation in that, which is less costly as well to go through. even before going to the court. And by the way, the magistrate judge, when he has his findings, his or her findings, whether the standard of care was reached or not reached, then that findings will be admissible into court. So if the magistrate judge were to say that the standard of care was met by this doctor, knowing that can be admissible into court in the event the patient wants to still continue, on with their case, it's a deterrence to do, because you've already heard from one judge, and judges are well respected, and they've litigated every type of thing under this sky.
Let me just get in here real quick. So with Vice Speaker's announcement that she's withdrawn her co-sponsorship, just reading the room, right? Usually where Vice Speaker goes, she carries 3 or 4 of these kind of administration supporting senators, if you will. So what do you think this does, if it does anything, to the support that you've already secured for this measure, Madam Speaker?
Well, as I told you, Chris, that from the start, this bill it's very clear it was going to be controversial. It's going to face opposition. And I think my colleagues who signed on were well aware of that because of the hearings we had in the prior terms. And, but they also, like I said, were courageous enough and really wanting to seek justice. And we've seen this by the legislature as a whole. We increased medical liability for the government from $300,000 to $500,000 in the last term, thanks to Senator Taitugui's bill. That had not been done again in years, maybe 30 years as well, right? And all of these things are we're just re-examining these injustices that have been laying still for many years. And I think we've got a legislature that's willing and able to face these head on. And so I'm just hoping we are under a lot more pressure, I think, because of the Vice Speaker's withdrawal. Of course, that might put other senators under a lot more pressure, as if we didn't have enough pressure on us already. But again, and it's easy to say, I'm going to look the other way and I'll let the courts come in and tell us our law is not good, right? And then the doctors are completely unprotected. So I'm trying to come in with a compromise for them right now that says, we're going to protect you in this way and in a more affordable way. And we're going to protect patients who have been harmed. We're going to allow them the claims that they are entitled to, not just the rich people, everybody. And I'm not, but despite the pressure, I think the bottom line is every senator is going to have to make a determination for themselves whether they can withstand the pressure. I don't like my family's healthcare being threatened. I don't like my colleagues' healthcare being threatened. I don't like, my neighbor's healthcare being threatened. It really makes me angry. And, but I just think we have to try to keep our heads calm, keep focused on what we're trying to do here, not abandon those who don't have a voice in this process. I don't expect people who've been aggrieved by medical negligence, who were unable to seek, they live with that all their life. And I don't expect them to mount this lobbying, in the scale that doctors are going to be able to mount. And so I think, all of us senators we bear that, we are their voices as well. Yeah. And so I'm just gonna ask everyone to just do their best. That's all we can do, and keep having hearings so we can hear them and keep improving the bill. This is how we do legislation, we make things better. I am a huge proponent of the more, the merrier, the more input, the better, right? And so I've seen this in groups that I've worked in, nonprofits, women's groups. I love it. The more, the better. And I've really seen things improve. And so I am, like I said, I've received testimony from some doctors that have really thought about it. And I appreciate that they have thought about it so well. They've read the bill so carefully themselves, and they're not taking the word of anybody else. And that they are willing also to listen to all the testimony. And so we're just going to continue to get the facts in front of us and make the best decision we can. And so I want to commend my colleagues who are able to withstand that type of pressure. Thank you.
Were you, Senator Tello, Senator Joanne Brown, were you guys disappointed by the Vice Speaker's actions in withdrawing her co-sponsorship of the bill? I mean, because it wasn't like she just withdrew it. I mean, she came with a machete, right? She came like, I'm withdrawing this, and I got 5,000 signatures here.
Apparently, she'd been working on for some time, right? Yeah. It's that was surprising to me, the method, because we had not even had a public hearing yet on the bill, and we knew already that there was going to be some opposition.
Well, for myself, it goes to show you, she can't take pressure. As soon as there are this elite group of people who are coming up to her and saying, don't support it, she runs. I mean, we were all put in this position, to care for the people of Guam, all people, rich, poor, middle class, everybody. And for her to just pull her support out, well, it's not like the first time. So I really think that, like the speaker said, she should have at least waited, so that we had a public hearing or even put on the floor. Everybody puts names on bills to be co-sponsors during session time, not like in the middle, not even having a public hearing yet. So yeah, well, it's typical.
Senator Joanne?
It's within their prerogative. Every senator has this prerogative, and we can't bind them.
Absolutely in their prerogative, and it shows their character.
Senator Joanne, I see you batting your eyelashes.
Well, I mean, it's unfortunate. It's unfortunate, certainly. I mean, we would love to have as much support as we can to address the issues and concerns of our people. But every senator ultimately, has to stand on their own position, what they take, and for whatever their reasons. I mean, they're free. Everyone is free to do that. I mean, we were all elected. I'm sure our people have expectations of all of us in terms of what they believe our priorities should be. And maybe each of us may look at it differently. I mean, certainly the Vice Speaker is entitled to do what she chooses to do. And that's up to her as a member of the legislature. She can vote and support what she chooses or what she doesn't. But certainly for all of us, we can do the same. I mean, nobody's vote, Chris, is more valuable than any other vote in the legislature, no matter who you are, whether you're the #1 vote getter or you're number 15 just getting through the door. We all have one vote. We all have one vote, and adding those votes up to 8 to pass a bill, or certainly if it gets vetoed, having 10 to override, that's what it comes down to. And, I'm sure we all have different perspectives, but when we do come to consensus, it's always the priority of wanting to ensure that the interests of our people are protected and represented. And that's why we're here. We're not doctors, we're not professionals, we're not specialists. We're just legislators. We're just legislators that are representative of the people in this community, all shaped, form, and sizes of who we are. And certainly we all have the ability, as having been elected with the power of the people, to make positions, take positions, and vote our conscience. So the Vice Speaker is entitled to what she chooses to do, as the rest of us are also entitled to choose what we choose to do and what we believe is in the interest of the community that we live in. Right, and that we represent.
Okay, I'm pretty sure we'll be in touch again. I put out the ask, the Vice Speaker, to the doctors to come on, and because I really want to see this debated, and I think it benefits everybody involved. Let's get all hands on deck, and I mean, if there's issues with it, let's hear exactly and specifically what those issues are, and then maybe you guys can come to a compromise.
Yes, thank you, and thank you again for, I agree. The more we hear from the community, the better as well. And the more that they understand it, because they're being highly pressured. And I want them to understand the facts, and I want them to understand who we're trying to help here, and who, that we're not trying to hurt anyone. And so I just hope that message can become very clear through the continuous forums that you are allowing us, and through the continuous debate. So thank you.
Thank you, Madam Speaker. Senator Tello, I just want to apologize because I know that, and guys, Senator Tello's been coming on for the whole pandemic. She's recovering cancer patient, knocking on wood, in remission. And she got a letter yesterday from her clinic basically saying, "Dear Mrs. Titagui, yep, sorry, can't help you. If you want a referral, let us know. You got 30 days. So, Senator Joanne also received a letter from her clinic. So if you guys out there are receiving letters, this is why. And, I mean, it's going to be one to watch, definitely. Thank you, Senators. Thank you, Madam Speaker.
Thank you. Take care.
Okay,
Bye-bye.
I'll see you. Bye. 922. Bill 112. Ow, it's hot, guys. I know we talked about this yesterday. We're going to go through the comments in a sec. But just two instances that I've dealt with medical negligence or whatever you want to call it. But I remember my grandpa had a heart attack and got operated on at the United States Naval Hospital. And they sewed up a pair of scissors